Do you find that sometimes you have a hard time sitting into your hips, lengthening through your glutes, or just have some tightness in the backside of your pelvis and hips that you can't get to let go? Well, let's try a little positional inverted hip shift to see if we can create more space and opening through that area of restriction to then help set you up for better eccentric glute lengthening in your other exercises. So what we're going to do here is we're going to take a block, and you might not necessarily go with something this high to start. You might want to start a little bit lower and ease your way into it to make sure that it feels okay. But we're going to go with the block here for kind of dramatizing the demonstration. And what we're going to do is you're going to have the block, and we're going to end up going into a forearms and knees position where you're going to have, in this instance, my left hip is going to be elevated on the block to help open up more of the backside of that left pelvis. So as I'm on that block, I'm going to let my right knee come down towards the ground, and you can see how that creates more opening in the backside of this left pelvis to help create that eccentric glute length that we'll need once we go into a loaded position or activity. What you're making sure is when you go into this position that you don't tip your pelvis forward, shift off to the side, one way or the other. I'll also show a little bit of variations you can do as well on top of this to get a little bit more opening depending on where your body needs it. So what we're going to do to start is you're going to have the block underneath your left knee, and I'll show you a couple different views for this. So it's underneath that left knee, and you're going to drop down onto your forearms. You want to make sure that your hips are right over your knees, your shoulders are right over your elbow, and we're making sure that we're not hanging forward and we're not overly rounded here. So you're just thinking a nice neutral spine. So you might have to push up through those armpits a little bit to open up this back space here. Now we're looking down, and you're making sure that your femurs, leg bones, are parallel to each other. We don't want your knees spread out to the side in this position. You're also making sure that you're centered over your left kneecap. We don't want to be tipped into the inside or to the outside. So I'll go ahead and show you this view where you can really see the tipping of this pelvis. So as I'm here, you're seeing that my hips come straight down to my knees on either side. They're not wider. I'm not shifted off to one side or the other, but I'm just squared off here. And you can see how my pelvis is now kind of draped down over that left femur and should create an opening through the backside of this left hip. Now, once you're in that position, you can do some breathing, thinking about inhaling into your back and into that hip, exhaling, feeling your abs and ribs and hip bones kind of connect towards each other without crunching down more, but thinking about how that exhale can help kind of pull your pelvis in the front and open up more of that space in the backside. You can visualize how your pelvis is melting down over that femur to help create more opening in the backside of that left hip. We don't want any pinching in the front of your hips or in your back along your SI joint. If you're pinching in the front of your hips, pay attention that your ribs aren't flaring forward or your pelvis didn't tip forward, and feel a little bit more abs keeping you held back in the position so that we're actually opening through that space there. If it bothers your SI joint or your back at all, definitely check in with a provider of some kind to help you assess if this is appropriate for you to do on this side, or maybe it's the other side that actually needs this work. A couple little riffs that we can do with it is once you're in that position, you can take your foot in and out. So as I'm here, I can take my left foot in towards the midline, or I can take it out away from the side to create different openings in the backside of my hip. To create more of a distraction and opening through the backside of my pelvis and the femur, I can take a sturdy band, making sure it's attached to something sturdy as well, wrap it around the front of my hip. You can always put a towel here if you need to, and come away. So the band is pulling back and then off to the side to create a little bit of distraction through the backside of that left pelvis. And so then as I'm in this position, this might help me feel like it can widen a little bit more and create a little bit more opening through the backside of that hip. Again, holding and breathing. You want to make sure with any of this that you're not creating any tension or gripping in the backside of that pelvis, but just using it as a position to help let that femur sink back into the socket and open the backside of that pelvis. Hold for about 5 or 10 breaths, get up, Go and revisit your squats, your lunges, or your deadlifts, and hopefully you feel a little bit more opening to the backside of that pelvis.